Hello and assalamu alaikum. Today we will study Park's three-step method to find out the paralyzed muscle in case of vertical strabismus or hypertrophic strabismus. So the three steps of this method are to find the eye that is high in the primary position and to find the gaze that shows the greatest disparity, either it is on the same side or on the opposite side. And the third step, we have to find out the head tilt either on the same side or on the opposite side that shows the greatest disparity of the deviation. So let's start with the question. If a patient has the right hypertropia that worsens on the right gaze but it improves on the same head tilt, which extraocular muscle do you think is involved? So let's solve this question. In the past three-step method, if we draw a block like this and if we arrange the directions of worsening of the gaze, such as worsening of opposite gaze, worsening on the same gaze, and in the case of head tilts, if we mention the best on opposite tilt and best on same tilt, so we can find out the which extraocular muscle is involved. So the muscles that can be involved in vertical strabismus are superior oblique, inferior oblique, superior rectus and inferior rectus. But we have to see if inferior oblique and superior rectus are involved, they usually involve the opposite eye. So if they are involved in your final answer, then they will be on the opposite side. So let's start with an example. If the patient has hypertropia of the right eye, so and it worsens on with the same gaze, the right eye is hypertropic and it worsens on the same gaze, so it will be on this area. If it is worsening with the head tilt of the opposite eye, which means it is best on the same tilt, so best on the same tilt, so worst on the same gaze and best on the opposite tilt. So the common extraocular muscle involved is inferior rectus, so the right side inferior rectus muscle is involved. So let's go to the next question. If the patient has right hypertrophic eye but it has a hypertropia that worsens on the opposite gaze, so worsens on the opposite gaze means if only superior rectus and superior oblique are involved. If it is worsens with the opposite head tilt, which means it is best on same head tilt, it means superior rectus muscle is involved. But since superior rectus is involved in the area of contralateral eye, so the left eye superior rectus muscle is involved. So this is the shortest method to learn the Park's three-step method. So hopefully you can solve these questions very easily in the future. Thank you very much.